that introduce them as puppies, but
Right.
what about when they're adults? Like, how do you get them to?
Um, it's tough
Yeah.
once they already have that mindset. But again, you can take them around other dogs as much as possible. But then you have to be a little more careful because you don't want dog fights. So.
Yeah.
Um, but yeah, socializing them is really the best, and then taking them for a walk a couple times a day, that also helps a lot to get them used to walking on the ground, seeing other dogs. You're in charge of the leash, you're in charge of the dog, and kind of put them back into the get them out of that alpha mode and put them back in that beta mode. So.
Great. So hyperventilating seems to be a common thing in Chihuahuas. It seems to be happening when their Chihuahua is scared or excited. Can this be life-threatening to a Chihuahua?
The trembling?
Yeah, just like the hyperventilate, like breathing and...
Oh, hyperventilating. Yeah, typically it's going to be more of a stress or anxiety-induced, that increased respiratory rate and the trembling that goes along with it. But yeah, it's not usually anything life-threatening. If their gums start looking blue or purple or pale, then you start thinking there's probably something else going on.
Okay.
But if it's just the kind of panting, breathing hard, and trembling, typically that's just an anxiety thing, and it's not usually a disease.
They were asking if what can they do when their Chihuahua is hyperventilating? Is there anything they can do to help the Chihuahua, or?
Honestly, the best thing is to kind of ignore it.
Okay.
The more you say, "Oh, it's okay," then you're kind of telling them that, "Oh yeah, that behavior's okay. I got to keep doing that.
Okay.
I get rewarded for it." So it's almost better to kind of put them down and not cater to that behavior. And then once they calm down and start acting more normal, then you say, "Oh, good boy," and then you give them treats and give them the attention. And you got to kind of let them associate the good behavior with the attention, not the bad behavior with the attention.
Mm-hmm. Okay. So the next question involves asthma in Chihuahuas. A Chihuahua follower has a 7-year-old male Chihuahua who has recently developed asthma about 3 to 4 years ago. The asthma seems to be seasonal or allergy related. Now she's tried different medications and inhalers to help her Chihuahua. Is there any other medication that you can suggest that will help her Chihuahua with her asthma?
Yeah, asthma's not terribly common. In older, it's usually more like a bronchitis type of thing, but same kind of idea though. But typically your two main drugs are going to be your bronchodilators to open up the airways, and then also the steroids, the anti-inflammatory steroids. So you can either do oral medications, which I'm not a big fan of. I like the inhalers a little bit more. I think they work better. So you can either do the oral, the bronchodilators, and the prednisone as a steroid, or typically what I'll use is I'll have the owners have albuterol inhalers at home. That's the bronchodilator. It works within seconds to a minute or two to open up those airways, and it really helps. And then the fluticasone or Flovent is the inhaled steroid that works well as well. And they make a spacer. I think Aerodog is the one big one that makes it. They make a little spacer chamber that you put the medication into, put the little mask over them, and that's how we give it. If you try giving it without the spacer, too much of it's going to go around the dog and not going to have them breathe it in.
Yeah.
But other than that, there's not much more you can do for the bronchitis, asthma. It's always good to take x-rays and make sure that it's not a collapse in trachea on top of it, because that's very common in Chihuahuas. And if there's a collapse in trachea, then there's other meds, steroids, and you can also use little bits of sedation with Torb or Vicodin, and then there's a surgery that you can do to put a stent in that trachea to open up that airway. So it's good to differentiate between bronchitis and the collapse in tracheas, because those meds, the bronchodilators don't work on tracheas. They don't have the receptors in the trachea for it.
Mm-hmm. Okay. So a new question. So a few followers, Chihuahuas, are experiencing a lot of gas and burping. Is there anything that can be taken to help the sore bellies, or is it just food related?
You can, main GI protectant that I use is Pepsid. Famotidine or Pepsid works well. Just kind of helps to decrease a little bit of that acid in the stomach. In a Chihuahua, you can give a quarter of a 10 milligram tablet once or twice a day, and a lot of times that'll help. If it's more large bowel gas type of stuff, there's Gas X. You'd have to kind of go a little bit low on the dose, like a half or a quarter tablet of the Gas X. That may help a little bit. But more likely it's going to be a little bit more kind of diet related and also stress related too, if they're swallowing a lot of air.
Mm-hmm. Okay. So another question about the whole belly thing that's got to do with food. So there's a lot of different dog foods available in the market. Is there a type that is specially suited for Chihuahuas?
Not really. Certain companies make their own small toy breed type of food, so that's going to be your best bet. IAM's Eukanuba, Science Diet, they all make different foods for the small breed, large breed, giant breed dogs. So that'll typically work a little better for them than just someone that makes a food for every type of dog.
Yeah. So what about homemade meals? What do you think of them?
I try to encourage away from that.
Okay.
If you're working with a nutritionist, then by all means, if that's what you prefer, then yeah, that would be fine. But it's just so hard to get them completely balanced with the minerals and the vitamins, and without a nutritionist helping you going over your food and actually testing it. There are some labs that'll take your food and test it to see what the balance is of everything. Without doing that, I would not be able to tell somebody if their diet is completely balanced. That's out of my realm, but so I try to encourage away from it.
Okay, cool. So you were mentioning hydrocephalus earlier?
Yeah.
Yeah. What is that?
Hydrocephalus, it's where the brain has fluid around it, the CSF fluid. And it's contained in these ventricles or these spaces within the brain. Normally these spaces are only supposed to be so big, and in some dogs they'll have either too much fluid produced or more often something that's decreasing the drainage of that fluid, and it makes it get bigger and bigger, so it's not draining very well. So when that happens, it presses on the brain and you get some compression, and then you get neurologic signs from it. And Chihuahuas are kind of the poster child for that disease.
What can we do to help a Chihuahua with the condition?
It kind of depends if they have signs of the disease or not. If it's just they have it and they're not clinical, you don't do anything. If they have it and they're having neurologic signs, tremors, seizures, circling, problems with their behavior, typically it's the seizures that bring them in, so you can either try anti-seizure meds. Some people will use steroids on it, and if those are not working, then you can have the surgery done where they basically kind of put a tube in that goes from the brain all the way to the abdomen, and it just drains the fluid into the abdomen, where you have the ability to reabsorb that fluid and kind of get rid of it a little easier.
Wow. Okay, so I've got one more question. So a follower was telling me about her friend whose Chihuahua was unfortunately killed by a bee sting. It was actually the second time the Chihuahua was stung, having survived the first one. Chihuahua is especially vulnerable to bee stings?
Not by the breed, no. It would be a dog-to-dog thing, whether or not they're gonna, kind of like in people too, whether or not you're allergic to bee stings or not.
Okay.
But yeah, it would be just that dog that was allergic to the venom in bee stingers. Typically, bee stings will cause some facial swelling. Sometimes they'll vomit, have some diarrhea from it. They'll have a kind of those allergic reactions. But if they have an anaphylactic reaction, where it's a full-blown immune system reaction, that's where you can get the pale gums, and they'll collapse, and the heart rate, blood pressure drop, and that's where you can have death from it. If a dog has an episode where it has an anaphylactic reaction, it's when you get them in right away, and usually we can give them epinephrine and some Dex, short-acting steroid, Benadryl, and get them out of it, and some fluids. And it's nice to have an EpiPen, kind of like basically a pediatric EpiPen that you have at home. And if they have it, you can give them that EpiPen. That'll at least buy you some time to get them in.
Great, thank you. So that was great. Thank you so much for the interview. Thank you again. Everyone's going to love all the information that you gave. A lot of information. Well, how do people find out more information if they want to ask you more questions?
Well, I mean, I do work on Just Answer, so there's you can always use that website. Otherwise, unless they're in Michigan.
So Just Answer is the best way to get in contact with you?
Yeah.
So hopefully this interview has helped you in your Chihuahua out a little bit. If you have any more questions, just click on the link below and it'll take you to Dr. Ryder's homepage on justanswer.com, and you can ask him any question that you want about your Chihuahua, or there are so many different vets online at justanswer.com waiting to answer your question now. So just click on the link below and go check it out. Thanks guys.